spin your passion into a business with Shopify and break sales records with the world's best converting checkout. Let's hear that one more time. The world's best converting checkout. Shopify's legendary checkout makes it easier for customers to shop on your website, across social media, and everywhere in between. Now that's music to your ears. Any way you spin it, you can be a smash hit with Shopify. Start your $1 a month trial today at shopify.com/records.
Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Good afternoon and welcome. I'm Wayne Callan, and you're listening to Attitude Magazine's weekly ADHD expert audio broadcast. This one's going to be an intriguing one, I think. The research community has done lots of studies on children and teens with ADHD, but not so many on adults with the condition, and very few on middle-aged, if any, and older adults. Lots of folks wonder if the brain fog, forgetfulness, and mental slowdown they may be experiencing are all due to Alzheimer's, dementia, or age. Not enough folks ask if these symptoms might be due to attention deficit. I bring that up because many experts say that about 75% of people with adult ADHD don't know that they have it. And if you don't know that you have it, you can't get it treated. If you are in your 40s or 50s or beyond, or you have an older sister or brother or a parent who you think might be slowing down mentally or have ADHD, you've come to the right place for some answers. Here you'll learn how ADHD should be assessed in midlife and beyond, how menopause affects ADHD, and vice versa, what treatments are safe, and how they should be incorporated into a regimen in which medications are being prescribed for other health issues. Today, we're very fortunate to have Linda Roggli to give us perspective and approaches to midlife ADHD. Linda is the author of Confessions of a Diva, Midlife in the Nonlinear Lane, a professional certified coach for ADHD women, 40 and better, and founder of the Diva Network. She is an expert in midlife and senior ADHD and offers workshops and retreats for ADHD women and couples. Linda, thanks for being here.
Thank you so much, Wayne. I really appreciate it. So we are going to talk about, is it ADHD or is it aging? It's a topic that's near and dear to my heart because I was diagnosed at midlife. So without further ado, let's jump in. I just want to remind everyone that there is no such thing as adult onset ADHD. I have a lot of people say, oh, well, I developed ADHD. It doesn't develop when you are an adult, but it may seem like it. So we'll talk a little bit about that later. But just know that there is no adult onset. It's kind of stuck like glue. We have it when we're babies. We have kind of that scarlet letter all the way through to our older age, that's for sure. And some of us don't test for ADHD when we get older, about half of us, as a matter of fact, but that's because we are compensating. We have worked out certain strategies that work for us, so we don't test for ADHD, but we still have that ADHD brain. Let's remember that in childhood, just a little review, in childhood, ADHD most experts estimated it between 8 and 9%, and this doesn't have anything to do with ethnicity or geography or any of that kind of stuff. This is overall the entire world around. Now, as I mentioned, about half of that number, about 1 in 20 adults, own an ADHD brain. And when we get up to midlife and beyond, the estimates range from 3 to 5%, but we're kind of somewhere in the middle. About 3.3% of adults ages 44 to 85, and I think beyond that, own ADHD brains. And that's what we're going to talk about today. This information comes from a study that was done in Amsterdam. It's a longitudinal study, which is the best kind of study to get these estimates because when you just go into a group for a very short time, it's not as effective as seeing them over time. But how many people is that when you think about it? Now, these numbers that I've pulled out are, I granted, extrapolations, but these are worldwide numbers. So the Gen X folks were born from 1965 to 1980, and some of them at this point, shockingly enough, are 40. Some of them are almost 50. So if we kind of lop off those that are 35 to 40 and stay with the 40 to 50-year-olds, there are probably about 3.1 million Gen Xers out there who have an ADHD brain. Now, baby boomers, which is where I am, were born from 1949 to 1964, and there's about 45 million ADHD baby boomers out there. And overall, there are 25 million people over age 65. Now, there is a little bit of overlap between baby boomers because we're getting older, too. So there's a little overlap in there. So it's not quite as many as that with ADHD brains. But I want you to remember that the population, and these numbers are worldwide, but just saw some figures that say in the year 2050, we will have 88 million adults just in the United States who are 65 and older. So what does that mean for us? That means that there are at least 70 million ADHD brains who are 40 and better out there. But as Wayne mentioned, 80% or more of them are clueless. He said 75%. Some people say 80. Some people say 85. They don't know that they have ADHD. And that's a problem because, as Wayne mentioned, we need to be treated. They've tried a lot of strategies. They don't know what's going on. And they don't even think. That doesn't even enter their mind. Nor, importantly enough, does it enter the minds of their doctors. At that point, we kind of feel like we have a case of CRS. And to put it gently, it's can't remember stuff. We can't retrieve stuff as quickly as we used to retrieve it. We simply don't really know what's going on. Like, am I losing my mind? We kind of feel like it's just all a blur out there. So we're going to talk about aging, ADHD, mild cognitive impairment, and dementia because it's really hard to separate them. So we're going to try and do that a little bit today. Remember that human brains are eons old, and we evolve pretty slowly. So our brains were not really evolved to think fast after age 40 because we never did really live to age 50 in the old days. I mean, I'm talking ancient days. So the fact that we are having trouble keeping up in the modern world is not too surprising because this busy world demands our attention at a lot of different levels. This group is often the sandwich generation. We are sandwiched in between our children, our parents, and sometimes our grandchildren, sometimes our grandparents, and often we end up taking care of a lot of those people in our lives. So we're kind of squished into that sandwich to begin with. A lot of us are empty nesters. All those kiddos and all those people that we've been raising for, whether you're a male or a female, a mom or a dad, they leave and suddenly we have this empty nest syndrome and suddenly we're our brains are not as occupied with those things. So we suddenly that's when CRS shows up. Some of us are dealing with divorce and some of us are dealing with grief and the loss of a spouse, the loss of parents, even sometimes, unfortunately, the loss of children or siblings. The other question that comes up for a lot of folks in this age bracket is, do I retire or do I keep working? Now, for some of us, that's not a choice. We have to keep working just to keep food on the table, et cetera, et cetera. But it is, when do we retire? How long can we go forward? So, as I mentioned before, that we have health issues, and health issues are kind of a distraction, frankly, for people with potentially ADHD brains. So we start feeling like we're losing our minds, as I mentioned. We kind of feel like we're out of control. So back to the question, is it AGE or is it ADD or is it something even worse? So here's the good news. Normal cognitive aging, which is what we're talking about here, has some good things about it. Our implicit memory is stable. Now, implicit memory is it's almost subconscious. It's out of our awareness. These are things that we overlearn, like riding a bike or tying your shoe or writing your name. So that kind of memory, we'll still be able to tie our shoes when we're probably 95 or even 100 perhaps. Language skills actually stabilize and sometimes even improve. That doesn't mean the definition of the language skills, but we usually know what words mean. Interestingly enough, crystallized intelligence is also okay. So crystallized is, if you think about a crystal, it actually is something that is stable, and you build on it. So crystals expand as they add more of that crystal material. They actually get bigger. This is what we're doing here. So this woman, who is probably a lawyer, sitting in front of all of her law books, she is building on the information that she learned in law school and building more information as she has different experiences as an attorney, and she uses those law books to help supplement that. So we actually do okay with this kind of information. The good news is that we recognize faces just as well as we always did. Now, that doesn't mean we remember the names. This is not the same. Those are two different things there. But we do recognize the face, even if we kind of go, sometimes I have to tell you, I'm kind of embarrassed. Sometimes I recognize the face and I have to think, is that a person I like or a person I don't like? Is that person mad at me or do I like that person? It's very embarrassing sometimes. The other good news is that our auditory attention span, which is also known as intermediate memory, is also stable. That means for the researchers, that means if someone tells you a string of numbers, you're going to be able to repeat them. Now, as long as that string is not 30 digits long, but simple auditory attention, we got it, baby. We're not losing it. But let's look at what's not happening as we get older. Now remember, I'm not talking about ADHD brains here. I'm talking about all brains, including ADHD brains. So normal cognitive aging, we have slower processing speed. And you may not know that it actually starts in our 30s. So by the time we get to 40, yes, we're really feeling this slower processing speed. Our executive function declines. That's that planning and organizing and execution piece of our brain. Working memory ability declines. Remember, working memory is holding one thing in our brain while doing something else and being able to relate them to each other. So some people call that intermediate memory. It's different from short-term memory, which I was talking about with the auditory memory just a moment ago. Our selective attention declines. That is the ability to shut out those distractions. So when we're driving, we know that we don't want to look over here at the cow in the field. We actually have to keep our eyes on the road and perhaps on that stoplight up. And we want to make sure that, we're not going to reach down and grab our pencil because it fell on the floor. That's selective attention. So that declines with age. And remember, these things don't take a nosedive. They actually are very gradual until, frankly, we'll wake up and say, what happened anyway? We have more driving accidents. Older people have more driving accidents because of selective attention, but also because of vision issues, also because of hearing issues, also because they may be taking medication that may cause them to not be able to pay attention. Remember, it's not just us, it's the other influences on us as well. And episodic memory declines. And that's interesting to me because when I just learned about this, when I was doing the research for all of these slides, those are the things that happen in your own life. We have trouble actually pulling those back up again. So that's kind of sad, but that's very true. So let's look at some more normal cognitive things that are on decline. Our visual construction skills decline. That means if you were trying to put together one of those bookcases that you buy at a big box store and it says, put screw in A into hole B, that kind of stuff. Those kind of things are a little more difficult. Inhibition of response, meaning that we are not always able to we're not able to think before we act, or sometimes before we speak. Conceptual thinking declines, meaning that we're not thinking about theory as much as we are thinking about very concrete kinds of things. And our divided attention also declines. I know this sounds depressing. I'm going to get happier in just a minute. I promise. That's multitasking. So if we're doing one thing over here, another thing over here, another thing over here, another thing over here, we don't multitask as well. I have a friend, after she turned 60, she said, I can't do more than one thing anymore. I have to do one thing at a time. And she's not ADD. She's simply over 60. The final thing is that we have this is a partial list, but we have fewer synaptic connections. And remember that synapse is that little jump in between the neurons that are in your brain. So the dendrites, which are on the little squiggly things on the end of that are neurons, the dendrites are shorter. There are fewer spines to capture our synapse neurotransmitters like dopamine. So if this begins to sound a little familiar to you, if you know anything about ADHD symptoms, you should not be surprised. So what I've done is I'm going through exactly the same symptoms, and I'm putting in blue the things that are applicable to ADHD. Yes, ADHD brains often have slower processing speed. We also have a really tough time with executive function. Some researchers believe that's the primary symptom of ADHD is a decreased executive function. Our working memory is very difficult for ADHD. I was tested for ADHD, and it was a group of numbers, and it was single-digit numbers. I was supposed to add the first two numbers together, and then the researcher gave me another number, and I had to add the second and third numbers together. You see how I had to keep the first one in mind, but actually saying another number? That was a difficult situation for me, which proved my ADHD. Selective attention declines, that ability to push out distractions, which certainly affects driving. And yes, ADHD folks have more driving accidents no matter how old they are. Imagine if you are pulling that, together with our advancing age as well. Episodic memory, not necessarily such an issue for ADHD. However, some people have some problems with spatial issues with ADHD. It's not a universal thing. As you know, ADHD symptoms are very, very different from one individual to another. So you can't say, okay, there's the ADHD poster child. We'll never have a poster child or a poster adult or a poster old person because we're too different. So inhibition of response, that's that blurting thing that goes on. That's us saying, I'm just going to tell you my truth. It's in my head, comes out of my mouth. So we do have that inhibition of response. So very, very similar overlap here of symptoms. Conceptual thinking, many people with ADHD have trouble with theory. They really want the practical pieces. Cut to the bottom line, give me the concrete pieces. That's one reason we like to get in there and use our fingers so that we can actually touch and feel it, so that we can actually understand the inside of what's going on instead of just these high and mighty theories and concepts above. Divided attention, multitasking is something we believe that we can do as ADHD folks. We don't always do it as well as we could do it, that's for sure, nor do older people. So that's another overlap of ADHD symptoms. And remember that synaptic connections that in ADHD are a little bit amiss. What happens is that our neurotransmitters can jump that little synapse, that little teeny tiny little gap, but sometimes they don't make good connections, or sometimes they're kind of pulled back, so that especially for dopamine, which is an excitatory synapse, that's the excitatory part of the synapse, dopamine is a very important piece for ADHD. So let's talk about the difference between normal aging and then ADHD plus aging, perhaps in this case, and what they call mild cognitive impairment. Now, mild cognitive impairment is a very different part of the brain from ADHD, and it actually can be a precursor. I think I have a slide about this. It actually can be a precursor to the dreaded Alzheimer's disease and dementia. So the deal here is, I'm not going to go into this very deeply because we are short on time, of course. You have to have a decline in at least two of these areas, and they adjust them for education and age. It's about executive functioning, back to normal aging. It's about memory, again, an issue with ADHD and normal aging. Attention, sounds familiar again, right? Language use. And so you understand this visual-spatial skills. You understand why this is difficult to sort out, because they look very similar. They sound very similar. So mild cognitive impairment is a precursor to Alzheimer's disease because it shares genetic and brain geography in the same location in the brain with Alzheimer's disease, but not with ADHD. So the good news is there is no known correlation between ADHD and MCI, or, most importantly, Alzheimer's disease as well. That's the good news, right? The not so good news is that there is one study, and I must emphasize that the word one, because one study is not been validated except in that area. It's been criticized somewhat. It is a retrospective study, and it showed a correlation between dementia with Lewy bodies and ADHD. It also showed that there was no correlation between ADHD and Alzheimer's, so that's good verification and good validation. Well, it's kind of the jury is still out on this, but I will tell you that dementia with Lewy bodies, and I didn't have enough time to go into all the details about it, but if you Google it, you will find that there are very, very many many overlapping symptoms with ADHD, and dementia with Lewy bodies is kind of under the umbrella of Parkinson's. And remember that Parkinson's is a dopamine-mediated disorder, so it kind of makes sense in the logical scheme of things. It may or may not be true. So don't take that. Don't run to your doctor and say, "Tell me if I have dementia with Lewy bodies." There may actually be some different screening for people as they get older. Remember that in the new DSM-5, there are symptoms that you have to have 6 symptoms if you are birth to 17 years old. If you are older than 17, the number of symptoms that you need to have to be diagnosed with ADHD drops to 5. Some researchers are saying perhaps people who are over 40 need even fewer symptoms to be diagnosed, and part of that is because of so much overlapping with age. It's also the reason that we don't have a lot of research. We'll talk about that in a few minutes. The important thing here, and everyone I have interviewed, everyone I have talked to says, do not try to decide which of those things you have, if any of them. And, well, you may have normal aging. You can probably diagnose yourself with that. But if there's any question in your mind about whether it's ADHD, whether it's mild cognitive impairment, any of those kind of things, please see a doctor, a competent doctor who will be able to sort those out for you. So let's talk about the ADHD hormone connection, which adds yet another piece of complexity to this whole situation. Yes, Virginia, ADHD does get worse with age, and one of the reasons it gets worse, especially for women, is that estrogen sits on the receptor site of our little synapse. So as our neurotransmitters jump that synapse, it is sitting over there helping, kind of like a sticky mitt, and I'll show you a slide of that in a minute, to help catch those neurotransmitters and help them stick. Now, for women who are still having monthly cycles, this line here is showing where the estrogen goes up and down. In the middle of the cycle, you'll see the estrogen is really, really high, and then it drops off at the end of the month. Now, if we superimpose ADHD on there, our ADHD symptoms go down as estrogen goes up. It's exactly the opposite curve. And what that means is that when we have lots of estrogen on board, we're perking along. We're doing fine. Excuse me, men. Not about you here for right now. But why does that matter? As I mentioned before, we have norepinephrine. Here's my little friend norepinephrine, and dopamine, my 2 favorite little neurotransmitters in human form. ADHD loves these 2 guys. Unfortunately, they are not always present. So, as I mentioned, the estrogen is that come to mama, baby. It's like I'm catching you, and here it is. I'm the pine tar in that mitt, so that we're actually going to let those neurotransmitters stay where they're supposed to. This is a lifelong estrogen level depiction, if you will. It's a little bit misleading because menstruation is monthly. Lots of estrogen when you are pregnant. Many women with ADHD find that their ADHD symptoms go way down when they are pregnant. They feel great. They can keep themselves together. And then they start nursing, and their ADHD symptoms come back because nursing it actually inhibits estrogen production. And so as long as you're nursing, you may feel like you're kind of, oh my gosh, you have the postpartum fogginess, if you will. Menopause, however, you'll see in the kind of red pink color over here, it looks like it's going up and down exactly the same, but that's not true. Menopause has huge spikes up and huge spikes down. Huge spikes up, huge spikes down before it eventually goes away almost completely. We never are completely out of estrogen, but you can see that the amount of estrogen is far less. So the change of life not only is hot flashes like this woman, but it also means that we have a change of brain. For men, testosterone also declines, and it's not as precipitous, and nor is it as dramatic, but it does influence sleep quality. It actually leads to more mood swings, which also can be related to ADHD as well. And cognitive function, which is interesting to me, cognitive function in older men goes down more than it does in women. Isn't that interesting? I didn't know that one was, more precipitous than the other, but I was very surprised to hear this. But remember that we ADHD folks, we survive by our wits and by our intellect. But when we get to the point where all these things are happening, the sandwich generation and our estrogen goes away and our testosterone goes, all those compensations begin to fall apart. And what happens is that ADHD roars to life, whether you're at midlife or whether you're a senior or whether you're somewhere even before or after that, even in the elderly, for heaven's sake. But it is never, never, I'm going to say this one more time, never too late to get a diagnosis of ADHD. Dr. Anthony Rothstein, one of my favorite people, says when an older adult comes in looking for an ADHD evaluation, he or she deserves the same workup as anyone else at any age. I have had a friend tell me that she went to the doctor. He did the testing. He said, yes, I believe you do qualify for an ADHD diagnosis, but what's the difference? It doesn't do any good. You're too old to treat anyway. Beep, wrong. You do want to treat ADHD, so let's talk about treating ADHD, shall we? Fewer than half of the adults diagnosed over 45 have ever gotten treatment for their ADHD, so that's not such good news, and only 25% have tried medication, which generally is accepted as the thing that helps the most. Of course, more studies are always needed to find out exactly how it works and what it does. But there are some concerns. Stimulants in particular may cause some cardiac issues. High blood pressure, for instance, it may cause some irregular heartbeats. We have to be careful about that. And the other thing is that you do not ever want to drink anything with citric acid, lemonade or orange juice, any of that kind of stuff, to take that within 2 hours of taking your stimulant medication unless you take an antacid, because it decreases the effectiveness. Strattera, which is atomoxetine, some studies show that there's an increase in glaucoma, which also is on the increase as we get older as well, so be careful of that. As you get older, sometimes your metabolism slows down. You may need to recheck your medication levels if you are taking them. If you are taking medication, you may need a lower dose or you may need a different medication. Don't expect that your medication to stay stable throughout your entire ADHD life. The other thing is, don't forget that as we get older, as I mentioned in a previous slide, that we have health issues in older age more than we did before. So do our other medications that we're taking for health issues play nicely with our ADHD medication? So let's see what the research says. Yep, crickets, baby. There's hardly anything out there. I just read a review of all of the literature on ADHD for 40 or 50 and better. It took 3 pages to go through. That was it. I mean, it wasn't like a list of them. Probably there may be 20 different, and most of them are with very, very small populations. So anyway, so what do you do for older adults that, and I have to tell you that the recommendations for normal aging actually mirror the suggestions for us as well. So I'm just going to share those with you quickly. Number 1 is use your brain. Do puzzles. Do something that's intellectually stimulating. Go back to school. Do computer games. But I need to tell you that you don't want to do the same game again and again and again. You need to use your brain in innovative and new ways so that it continues to be challenged. Another way that what we're going to do is we're going to move our body. Exercise is good for everything. Why are we not all doing it? Because we're ADD and we can't remember to do it, or we forgot, or oh, I can't do that today because I'm too busy. But it is really important to move your body. It helps your brain. Important that we have people around us, not necessarily ADHD people, but we just need to connect with other people and not kind of isolate and stay in our own little corner, whatever that may be, whether it's a cubicle at work or whether it's home, wherever you are. Fish oil and vitamin D are really important. So fish oil has been proven, and you're taking a fairly good dose of this. You're talking about probably 2 or 3 grams of fish oil, and take very high quality fish oil. Vitamin D actually protects, it improves attention and protects reaction time. So they're both good things to take, and they won't hurt you unless you overdose on vitamin D. Don't do that. But let's also talk about quickly what happens when you are ADHD and you find out that you have ADHD when you're 65. I just talked to a woman today who found out she had ADHD last year. She's 48. I talked to another woman who is 93, and she found out that she had ADD 2 years ago. So ADHD is different when you are diagnosed older than when you're diagnosed younger. What does that mean? Well, your reaction may be, that may be a similar reaction to other younger people as well, younger adults. Some people are shocked. Some people are really sad. I have a friend who went into a deep, deep depression because she goes, there's one more thing wrong with me. It's all my fault. Some people are skeptical. So what if I have ADD? I don't, this is just doctors. There's no such thing as ADD. Oh, don't set me off there. Some people are relieved. They feel like, oh, thank goodness, there's some reason for all of this. But almost universally, there is the piece of regret that if I'd only known about my ADHD earlier, I could have done fill in the blank. I could have run for mayor. I could have started my own business. I could have finished college. I could have gone to Singapore, any of those things, because life is short. You know, we only have a certain amount of time. And really, that's all we have on this planet is time in our lives. And when we get to 50 or 60 or even 70, there's not a lot of time for do-overs. So will an 80-year-old woman decide that her dream was to climb Mount Everest and do it? She may or may not be physically able to do that. So her dreams may have to change, but that doesn't mean she doesn't get to have dreams. As a matter of fact, being diagnosed with ADHD can be a fresh start, a brand new way of looking at yourself and your life. So the yellow brick road is still there. Now, whether you're going to the Emerald City or whether you're going to Boston, I don't know, but don't forget that you actually still have an opportunity to live the life that you've always wanted to live. You rethink your priorities. What is it that you've really always wanted? Maybe it really is to spend more time with family or with your beloved spouse or a partner. Maybe it really is to go back to school. It's not too late to do any of those things. I have a friend, actually a client, who climbed Mount Kilimanjaro for her 50th birthday. Now, she trained for it. She got in shape, all that kind of good stuff. She wasn't in shape, I will tell you. It was a hard situation, and she ended up having pneumonia right before she was supposed to go. She almost gave up the dream, but she did it. And she said when she stepped off of that plane in Africa, and the humid African air, warm, humid African air hit her, it was just like intoxicating. It was almost as important as her reaching the top of the mountain, because she had landed in Africa and she was living her dream. So why not you? What is your Mount Kilimanjaro? Why not you? Live your dreams. So if you are diagnosed with ADHD, or if you're suspicious that you might have ADHD, or whether you're in complete denial that you may have ADHD, the truth is that we can embrace life with this unique perspective, with ADHD on board, not letting us define who we are, but letting us goad us and guide us to something even better and more magnificent than we already are. So I invite you to go with your flow, not anyone else's, yours. Because you're the only one that's important in your life when you really get down to it. You are the only one that has any control over that. And then perhaps you too can stand and with exaltation to that beautiful, beautiful view there and say, I've done it. I've lived fully and beautifully. So I want to tell you that I have created a Midlife to Senior ADHD survey, and you can find it at bit.ly/ADHD40+, if you'd like to take that survey, because there is no research on ADHD. This is not research, but it is an anecdotal study, and I will come back to that if you want me to. But the AD Diva Network is my network for women 40 and better. Now it's actually becoming 50 and better, and Confessions of an AD Diva is the book that won first prize for women's issues, and I'm very proud of that. So with that, how'd I do? How'd I do, Wayne?
Fabulous presentation, Linda.
Good.
Really great. Really, really great. I was so entertained and informed.
Great.
And loads of folks have questions, of course.
Okay.
And one that's come up quite a bit is, what kind of doctor should I see to be evaluated? Does it make sense for a 73-year-old to see a pediatrician? Will a pediatrician even see me?
Great question. There are so many people looking for ADHD specialists out there, and unfortunately the supply has not caught up with demand. My strong suggestion is that you see a psychiatrist rather than a general practitioner or a pediatrician. And the reason I mention that, and well, first of all, let's just say that probably the reason she mentioned pediatrician is because pediatricians deal with ADHD much more often than internists and a lot of other doctors. Psychiatrists should be, and I emphasize the word should be a little more attuned to that. So that's the first place I would go. And remember that it doesn't have to be a medical doctor. It can be a psychologist. However, it needs to be someone who has a doctorate, either a PsyD or a PhD or an MD. And the answer is, to your second question, will a pediatrician even see you? Yes, they will. They absolutely will. I talked to someone, I think it was Dr. Bill Dodson out in Denver, and he said that most people in Denver, think about how big that place is, most adults there get their medication and get their treatment through a pediatrician. So don't be afraid. If that's the only option you have, go there. But please go. That's my important insistence.
Mm-hmm. Is there, you referenced heart issues before, an ADHD medication. Krista asks, is there a medication that works better for people who do have heart issues?
Thank you for asking that question, because the real issue with cardiac, the real medication that has issues with cardiac are stimulants. So if you use another medication for ADHD, for instance, Strattera, which is generically known as atomoxetine, that does not have heart issues. Some people, it's one of those love it or hate it kind of drugs. Some people just, it really does help them focus, but it doesn't. It's not like a stimulus like, ooh, I really can feel this. Atomoxetine works a little bit more gently, if you will, more subtly, but some people get very good focus from that. I had a client who was a young teenager who was having eating disorder issues, and she was having trouble maintaining her weight. She kept losing weight. Therefore, they would not let her take stimulants. And they put her on atomoxetine, also known as Strattera, and she did pretty well. She did pretty darn well. The other thing that you may want to consider in terms of medication is that there are what they call second-line drugs for ADHD. One of them is Wellbutrin, which happens to be a drug that I have taken forever. I think it's like water. My body just needs what Wellbutrin provides, and what Wellbutrin provides is dopamine and norepinephrine, my two friends, as you saw earlier. That's also a second-line drug that's used. It has a little bit of a stimulant effect, and the only serious downside that people have with that is that it does increase the possibility of seizures. So any medication has to be treated carefully. There also are some high blood pressure medications that also treat ADHD, Klonopin, some of the other ones, and some of them are used in combination. So don't be afraid to work with your doctor to try more than one medication, because just a little bit of one medication may augment your primary medication just to the point that it's working perfectly. And I just want to say just another word about medications, because for us, getting the medications right is as difficult as it is to finish projects or to begin projects or to remember where our car is parked in the parking lot. It is a very difficult thing because it's a linear process. So there are some people who have, I think Lori DuPar has one on her website, and I think there are some other people who have some medication log books, if you will. So that you can record when I took this medication, this worked. Oh, actually, the website ADA actually also has an app that does that, storylines, so that you can record how you're feeling when you take that medication, so that you can take that to your doctor and say, well, this is what happened, instead of, it didn't work. I don't know. It just didn't work. That's not helping your doctor figure out what might work. And one more thing, and that I'll let this go. I have a former client who went to her doctor, and she said, after she was diagnosed, and she's one of those people who fell into a deep depression after she was diagnosed, actually. She said, how can I tell if the medication's working, her ADHD medication? And her doctor said, if you can't tell whether it's working, it's not working. So they worked and worked and worked to fine-tune that exact combination of medications, and now she really knows when it's working and can tell when it's off a little. If she gets a little too sleepy or if she's getting a headache, she can absolutely tell that. She's paying more attention, and I think it's difficult for a lot of us to pay attention to what's going on in our bodies, even as much as it may help us. So I'm sorry to go on a big tangent, but
No,
that was
that's
all.
great advice. That's great advice. Another person writes, and I learned that a lot of my behaviors aren't me, but due to my ADHD. I was on a cloud for 2 weeks. This woman is 68. But now I wonder what my first step toward treatment should be. Do you think talk therapy is a good idea, since I have spent many years feeling bad about myself?
That is such a common issue, and I feel for you, Miss 68-year-old. Certainly, there are two diverging roads here, and they're actually parallel roads. They're not really divergent. Talk therapy has not been proven to be effective to treat ADHD symptoms. Talk therapy is generally not going to get you to clean up the piles that are on your desk, or help you get to be on time, to help with time management or time control. Talk therapy, however, will do exactly what you're asking about, because low self-esteem and low self-image kind of parallels ADHD throughout our lives. Whether we're diagnosed or not, it can still hang on, because you've had 68 years back there of all these things that you had done, what you perhaps thought were wrong. I'm using air quotes as I say that. And the reaction of other people and your own self-talk and your own kind of, I'm going to beat myself up about this again, that's where talk therapy can really help. And that, of course, is covered. That's just a regular psychologist. My strong suggestion is to see if you can find someone who knows something about adult ADHD, and I mean that they really do know about it. A lot of people will say they know about it, and then you go to them and they say, well, if you're late, I'm going to dock you, and blah, blah, blah. And I can't stop you. That's not somebody who understands ADHD. When I went to my therapist and I was 10 minutes late, she said, oh, yeah, 10 minutes late, no problem. That's what she expects from ADHD folks. Now, do I get my full hour? No. I get my 40 minutes instead of 50 or whatever. But the one thing that is very good is cognitive behavioral therapy. They call it CBT for short, and that will help you with the actual ADHD issues, because it's very practical. If you do this, then this. If you do this, you do this. And for me, sometimes it's a little too linear, but really cognitive behavioral therapy is kind of what ADHD coaching is based on. So I think that you can get the help that you need in any of those places, but each one of them has their own specialization. So coaching and CBT will be more about getting you on track and helping you stay there, and perhaps helping you live your dreams. And talk therapy, traditional psychotherapy, will be much better at helping you understand what's gone on with you and what you can do to change your attitude toward yourself, and begin to give yourself a hug and love yourself, because you deserve it.
Something I'm very curious about, does ADHD at an older age present differently in women than it does in men?
Well, I think ADHD presents differently than men in a lot of cases, but I have men tell me that's not the case. I've written, because I work mostly with women, I have written articles for women, and I've had men say, well, that's exactly how I felt too. So I'm not sure that, let me just start over. What I read in the literature is that ADHD stays the same all throughout your lifetime. So I don't know that it's a gender issue or whether it is an individual issue. Now, I will certainly say that women will present differently with ADHD and perhaps more dramatically because of menopause. As you saw, that decline of estrogen was steep. And men simply do not have that. But I also thought back to that statement that in the literature that I was reading, is that, and actually Dr. Rothstein is the one who mentioned it to me first, is that he has more men coming to him to ask about ADHD diagnosis than he does women. Now, that doesn't mean that there are more men who have ADHD, but because men's cognitive decline is more steep than women's at an older age. More men are worried that, what am I doing, losing my mind? There's got to be something going on here. And remember, too, that no matter whether you're a woman or a man and you are older and you feel like you're just not as sharp as you used to be, and the truth is you're not. Look at all these things that have come up that I've talked about today. The truth is that no matter what age you are, at the over 50, over 40, the truth is that it's all going to be individual to you. So the answer is I don't know, and there's a lot of little facets to that. Does that make sense, Wayne?
Yeah. Sort of in the vein of one-stop shopping, if you're being evaluated for ADHD, should you also ask your doctor to evaluate for Alzheimer's at the same time or any of these other things? I mean, it seems very, very difficult to sort of tease out one diagnosis over another. I might be wrong.
Absolutely. No, I absolutely agree, and that's a great question. My guess, Tony Rothstein says that the only way you're going to be able to diagnose any of those things, because remember, they're all behavioral issues. It's not like we can take a blood test. Now, you can see Alzheimer's tangles and things if you do imaging, if you do CT scans and that kind of stuff in the brain. But that's kind of an extreme and expensive way to go to diagnose anything, and there's no brain scan that diagnoses ADHD at this point. But the answer to should you have your doctor evaluate you for Alzheimer's, et cetera, the testing for Alzheimer's is very moderate. Even your family doctor can do that. So if you want to be tested for it, that's fine. But I guarantee you that if you talk to your doctor and he doesn't suggest that you go to a neurologist, that's the person who's going to treat Alzheimer's, not a psychiatrist, he or she will know before the end of your appointment whether you even need to be tested. Now, mild cognitive impairment may look very similar to ADHD in its early stages, but remember that your ADHD is pretty much going to stay the same, and and remember the key here is longevity of symptoms. If you are worried that you might have Alzheimer's disease and you look backwards at your life and you say, I never had any trouble. I got to school on time. I got my papers turned in. It's just lately that I've been having all this problem. And, sometimes for Alzheimer's patients at least, they'll put the milk in the pantry. They won't remember what they did, that morning. They won't remember. They won't even know someone eventually in the later stages of Alzheimer's. ADHD folks don't have those issues. ADHD folks can go, oh yeah, my clothes were all over the floor when I was 10 years old, and my mother was always yelling at me, come on, we're late. Longevity of symptoms differentiates those more serious and more sinister issues with aging issues and decline than it does ADHD. So even though they're all intersecting, I think your provider is going to know instantly whether you need to be tested for those other more serious things. Mm-hmm. I'm sure of it.
Several about prescription medications. Some people are on 3 or 4 already. They're concerned that their doctor be up to speed on all these medications before prescribing a stimulant. So
absolutely.
I don't know. Is this time for a second opinion? I mean, how does one go about this?
Well, I have to tell you that I've done a lot of webinars and I've talked to a lot of experts, and many of them will say, go to your doctor and spread out all the medications and say, what are the interactions here? And does A go with B, and does C, influence this? And just as I said about the citric acid, that reduces the effectiveness of stimulants, and many people don't even know that. Grapefruit juice does it, and so there's all kinds of things out there that interact. Let's face it, all medications have side effects because the effect can be considered a side effect too. Anyway, I'm being silly here, but your doctor needs to know all of this, and if your doctor will not sit down with you and help you figure this out, find another doctor. That's what most of the people that I talk to will say. And I got to tell you that I'm not really happy with that advice. The reason I'm not happy with it is that many of us are locked into a doctor because of insurance. Many of us are locked into a doctor because you can't find someone else, and many times there's not anyone out there who can deal with ADHD medications as well. So the gold standard, let them get the PDR out, which is the physician's desk reference, which tells all the interactions about your medications. But I will also mention that you can also take a little bit of responsibility for this yourself, and that is to read those little inserts that come with your medication, at least if you have brand name prescriptions, not always generics. Because all that little 2-point type in there, that's where people found out that citric acid affects the effectiveness of stimulants. If you read that stuff, you're going to find out a little more stuff. You know, you're going to find out exactly what this does. Of course, it'll also scare the heck out of you because every drug you take is going to say, could be death. Yes, whatever, could fall in a bathtub, whatever. But I will say that I'm so glad you were asking the question because that means you're aware. The people who are in danger of this are the people who are not thinking about that. They're just going to the doctor and the doctor says, take this, and they do it. I think that happens less often in the day of the internet and the day of kind of patient advocacy. But thank you for asking the question, and be like a bulldog. Stay in there until you get the answers you need. And, I wanted to mention one more thing. Your pharmacist can also help with that. If you have a friendly pharmacist, he may be also able to help with that.
Yes, actually, someone brought that up. They chipped in some advice on that question and said, talk with your pharmacist. So I'm glad you brought that up.
Well, they're the experts, right? They really are the experts,
Right. Some people wanted to know a very specific question. Do you have any general ballpark figure? I know you're not a doctor, et cetera, but you mentioned vitamin D. Any suggestions on dosage there?
Vitamin D is normally when you go in and buy vitamin D supplements, and it's D3. It's that D with the little 3 at the bottom of it. Generally, when you go in to buy supplements, it usually is in 400 IU, which is the unit. But I actually have found that the research that I've seen, and believe me, you can find research that'll disagree with this. As much as 1,000 units a day is not going to hurt you, and that's what I take for me. And the added benefit for both men and women at an older age is that vitamin D3 also helps with bone density and porosity. So there's kind of a double benefit to that.
And hormone replacement therapy, another specific. A lot of people brought that up and said, well, since I've been on hormone replacement therapy, I noticed that my ADHD symptoms aren't as bad.
Well, I didn't want to go there because I usually do, but because we were covering so much territory today, Wayne didn't think I could get through these slides. I didn't want to add more slides about HRT. Let's talk about that for a minute, though, because that's just my own experience is that when I hit menopause, I lost my brain. I couldn't put two words together and come up with a sentence. I mean, it was really, really bad. And I ran. Before then, I'd not taken ADHD medication because I was kind of in that skeptical, so what? Yeah, it makes sense, but I don't care. When that happened, I didn't just casually walk. I ran to my psychiatrist and said, now I need them. I need the drugs. I need them right now. And he very calmly looked at me and said, women's ADHD brains need estrogen. Go get some. And I'm like, well, can't you just give me some? And he said, no, you have to go see your OBGYN. So I had done tons of research. I kind of pushed menopause aside for years. I didn't want to look at it, which is unlike me. I usually am researching everything to death. I finally said, this is going to happen to me. I better do something about it. I better find out about it. And of course, what I found out was, for me, the timing was terrible because it was just when the Women's Health Initiative had been released saying that hormone replacement therapy was terrible. It caused cardiac problems instead of prevented them and all kinds of stuff. And it was so serious that they stopped the study. But the difference I found out, and it took a year for my psychiatrist/OBGYN to convince me. She was both. Can you believe it? I found one that was both a psychiatrist and an OBGYN. Amazing. It took a year for her to convince me that quality of life is important here, and the at least the piece of the study that they stopped, the WHI that they stopped, because there were several different components, I think 6 different components of it, was a very bad study. It was poorly done. And the reason it was poorly done is because they started hormone replacement with those women who had already been through menopause for up to 10 years. So they started women in their 60s and keep in mind in that 10 years, they had already developed some heart problems. And when they started them on HRT, the estrogen actually began to loosen up and make more flexible those arteries. And then the plaque would peel off and suddenly we'd have a cardiac incident. So I finally got it. And the other piece of it is that progesterone was also included. It was a combination pill. It was the old original kind of, I'm blocking on the name right now, but it's Premarin. They were giving people Premarin, so they had a combination of those things, which is okay. If you have a uterus, you need some progesterone because you don't want to have uterine cancer. There is a danger of that. But because they gave it orally and a bunch of other complicating factors, it really was not well done. So I started an estrogen fairly soon after menopause, and now I was just lucky. That is exactly what women are advised to do now. To start hormone therapy, they call it HT instead of HRT these days. If they start HT within a year of their last period, and frankly, I was taking some kind of low-dose birth control even before that to help control my migraines, because remember that I talked about the up and down of estrogen, and low-dose birth control pills at least smoothed me out so that I could function. My migraines went away. I was calmer. I was good. Then I went off of it, and that's when everything kind of went like craziness. So what I did, and this is not a doctor's recommendation, this is a personal anecdote. I want to be clear about this. Do not run to your doctor and say, well, Linda said to do this. Ask your doctor about it. Dr. Patricia Quinn, who has been a pioneer in ADHD and hormones, says to do exactly what I accidentally did, and that is use unopposed estrogen. I say that real quietly because when people are going to go, oh my God, unopposed estrogen. Progesterone makes your brain foggy. Let me say it again. Progesterone causes brain fog. She recommends that you are on unopposed estrogen. I happen to use a patch rather than a pill. And I'm on unopposed estrogen for 3 months, and then I take 2 weeks, and I take 2 weeks with my progesterone. That helps protect my uterus. Then I take 3 more months then I use 3 more months of unopposed estrogen, and I use the unopposed estrogen all the time. For me, that's almost like my Wellbutrin. And the effect of it was almost instantaneous. Within 2 days of me putting that patch on, I was a new woman. So I agree with what you said. Using hormone replacement absolutely improves symptoms, and remember why? Because it gives us back some of our estrogen function, and estrogen helps our neurotransmitters, and that's what helps ADHD. Makes sense, huh?
Yes. This last question is from a 69-year-old man who was a scientist, and he's said he's already figured out how to deal with his undiagnosed ADHD. He thinks he has it, and has all his strategies in place, and they're working. So he says, should I even bother at this point being evaluated?
No, the answer is no. But the truth is that if you are satisfied with your life, remember that a diagnosis of ADHD, by definition, has to cause some problems in your life. And my guess is, from the way the question was relayed to me, is that there probably were some issues for him with ADHD previously, but that he has developed the compensations that work for him. And if they work, then leave it alone. This is my little soapbox, but I believe that if you suspect you have ADHD, the only reason to get a diagnosis is, number one, to validate your own suspicion. Yes, that's it. That's been it all this time. I get it. And the most important one, though, the second one, let me just say, is to get medication. Because you are not going to be able to get medical treatment for your ADHD unless you have a diagnosis. And remember, insurance companies don't cover things that are good; they cover things that are bad. So you go to them with, I have happiness syndrome. They're not going to cover that, even if you want some whatever vitamin C. I don't care, but they will cover depression because there's something wrong with you. And ADHD has been determined to be something that is wrong with us, with our brain, even though I disagree with the wrong part. And it also is something that can be treated using some medical treatments, including, as we talked about earlier, talk therapy. Some psychologists actually do some coaching as well, even though they're not supposed to turn that into insurance. Shh, they sometimes do. And the other piece is medication. So if you are doing fine the way you are and you're coping, why bother? Unless you need that validation that says, yep, I knew it, that's what it is. So, and it's expensive. Remember, sometimes it can be very expensive to be diagnosed. And just one more word about evaluation. Please, please, please do not let someone just give you a quick little test and say you got it or you don't. You need a thorough intake, and that is someone talking to you about your history, your childhood, your past, longevity of symptoms. So please, please, if someone says, yep, stamp, you got it, run the other way.
Well, Linda, that'll have to be the last question. That really was wonderful. I know you put a lot of complicated stuff in perspective. I don't think anyone could have done a better job. So I'm really, really thankful that, our folks could be able to hear that from you. So thank you again.
I appreciate all those questions, and thank you for letting me be here today.
Have a good day, everyone.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.